you talk about the difference between muscle, tendon, and ligament and how they factor into asana?
Well, the musculoskeletal system is made up of muscle, which is primarily called soft tissue. It's expandable. It can contract and it can expand and separate. Muscle is made up of many muscle fibers, and those muscle fibers come together at either end to make a tendon. And those tendons attach to one bone or to two different bones. And that is how you actually create movement. Now, the connective tissue, which is fascia and your ligaments, that works differently. They are much more dense and they're made of more collagen, which is more restricted material. You have less nerve tissue to it and you have less blood flow through connective tissue than through the muscles. So, and ligaments and connective tissue in general attach bone to bone. Fascia is a broader connective tissue and it might encompass the whole width of your back. And so if that gets traumatized through accident or for whatever reason, and that becomes constricted, it's going to decrease your range of motion and it may even increase discomfort when you try and do specific asanas. To do asanas with that kind of pain or with that kind of range of motion limitation is not going to be overcome by doing more asana. You either have to get some external force working on it, either through a skilled body worker, or you have to find some range of motion exercises which will facilitate the breaking up of that scar tissue if it has developed. When you start doing asanas and you start going into particular ranges of motion, which may not be conducive or normal in a human's range of motion, then you have to recognize that there may be restrictions anyway just because of daily life activities. If you sit in a chair all day long at work and you get out and you run to your yoga class, you may have difficulty doing some poses because sitting there restricts blood flow. It can just tighten up the connective tissue as well if you're not moving sufficiently during the day. So it's important that you find ways that you can facilitate making your asana practice more effective for yourself. And I would suggest getting that assessment by some highly skilled person who knows what the normal ranges of motion for human beings are. If pain is rising because you go through those particular ranges of motion. So do take care of yourself when you start doing any kind of movement. It doesn't matter if it's asana, Pilates, or Zumba. You really need to get that assessment.